So what is heart failure? Congestive heart failure or heart failure is a long-term condition in which your heart cannot pump blood well enough to meet your body's needs. So how common is heart failure in patients who have diabetes? Diabetic individuals, as compared to other people, have 2 to 4 times more risk of developing heart failure, whether it is reduced ejection fraction or preserved ejection fraction. So diabetic individuals are more prone to develop any sort of heart failure, especially reduced ejection fraction heart failure. What can cause heart failure? The common reasons why people develop heart failure, as I've told, one is diabetes. Just being a diabetic can cause heart failure. People with diabetes can have concomitant high blood pressure. Blood pressure itself can exist as a separate illness, and that can lead to your pumping capacity reduction of heart failure, or whether you can have a preserved ejection fraction heart failure with a high blood pressure also. Both of these frequently coexist. So a diabetic individual can also be hypertensive, or a hypertensive individual can be diabetic. These two in combination can further lead to what is called as coronary heart disease or coronary artery disease, wherein you can have a reduced blood flow to your arteries of the heart, which can gradually reduce the pumping capacity and lead to again heart failure. Then people who develop acute heart attack, as we know it, or myocardial infarction as it is called in medical parlance, these people, they actually lose a part of the myocardium or muscles of the heart. That is again a very important reason for heart failure. Then there are other less common reasons. More important one is where you cannot actually recognize a cause for heart failure, which again forms a big chunk of population. So you can have heart failure without any obvious reason. You can have heart failure because of a heart attack. You can have heart failure because of arterial involvement of the heart, cardiac muscles, or you can have diabetes and blood pressure, or a various combination of all of these factors which can cause symptoms of heart failure. Then there are diseases which are much more common in India as compared to other parts of the world, that is valvular heart disease, especially rheumatic heart disease, wherein muscular capacity of the heart falls because one of the valves is leaking or more valves are leaking. So these are again individuals, but here in surgery for valve can be easily done, and most of these patients they get quickly. Other recognizable features which are seen in the today's urbanized world is obesity. Very obese people, they will initially tend to have heart failure with a preserved ejection fraction. These individuals also tend to have what is called as an obstructive sleep apnea, which is easily recognized by family members as somebody who snores heavily and then feels sleepy all through the day. So these are individuals who are also prone to developing heart failure. Remember, smoking, alcohol, these are the two common problems associated with onset of heart failure. So a high degree of alcohol intake itself can weaken the muscles of the heart. And smokers, they can develop all sorts of muscular diseases, and they can also have involvement of the heart arteries or coronary arteries and lead to muscular damage. So how would you recognize heart failure? As I told you, patients who develop heart failure will have symptoms of breathlessness, easily getting tired, muscular weakness, lack of stamina, and then of course in the later stages we will have swelling occurring over the face and feet and abdomen. These patients, they will complain to their doctors that they are unable to walk properly, they get tired easily, they feel so out of breath that they can't go for their routine walks, and then gradually when it is severe, they will have breathlessness even in small chores like taking baths or climbing a flight of stairs or even pushing a motion for toilet when sitting in toilet. So these are the cross conditions, and these are all recognizable by a common individual, and so based on this, you can go for treatment. What happens if you don't treat your heart failure? Heart failure is a fatal condition. The amount of mortality associated with heart failure is much worse than several forms of cancers. So it is not something which you can easily overlook. So lots of patients are likely to be dead within the first year of their diagnosis. A good 30 to 40% people will be dead in the next 5 years if they are not treated well. So heart failure is a sort of malignant disease which kills quickly, it kills a lot of people, and it has to be taken care of. If you do not treat it well, then of course your lungs, gradually your kidneys, your liver, they will also start getting distorted, and they will also start malfunctioning. So how will you manage? Of course, the part is simple for a common man. The management of heart failure should be left to your doctor. The doctor is likely to prescribe certain forms of medications that you need to take regularly. But on your part as a patient, you need to know that you have to restrict your salt intake. total amount of fluid intake has to be restricted as per the doctor's management guidelines for you. And that amount of liquid intake will determine how well your symptoms are controlled. And of course, you will need to check your sugar and blood pressure in control, get it timely checked by your doctor. He will manage the dosages of all the important medications accordingly. So, heart failure management requires a holistic approach. It needs the help of the doctor, the patient himself, and the patient's family. Everybody has to be involved in the treatment of heart failure, because if you are forcing your patients, if your family members are letting them have too much of salt or liquid, and of course, despite all treatment, the patient's health will not benefit. Similarly, if the patient himself is not careful about what he's eating or drinking or timely intake of medications, again, he is not likely to improve. And then, of course, frequent visit to your doctor so that he can titrate your dosages according to the conditions. They are all important aspects of management of heart failure. The good news overall is that we have very effective treatment for heart failure nowadays. Mortality is going down, the quality of life of patients has improved drastically, and patients are doing much, much better as compared to what they used to have 20 years back. So, heart failure is a bad disease, but nothing to feel sad about. Cheer up. You have a good management and skilled doctors available around you. With the help of your doctors, family, and your own motivation, you can overcome this problem. Thank you.